As industries and sectors across the world continue to embrace the adoption of digital technology, the health sector in Nigeria and Africa come to the front burner at the Future of Health Summit organized by Forbes Africa in partnership with Philips. CNBC Africa now brings you highlights from the event. I am Christy. Welcome. Let's start first with your thoughts on the state of the healthcare system in Nigeria.
It's abysmal. You know, it's not the kind of healthcare system we require for a large country like ours, a large population, which is why we have all kinds of strikes every time. We have skills are going overseas, doctors and nurses are overseas, patients are going overseas if they can afford to, and those who are not basically have to then, you know, make do whatever is available. So I think it's essentially on a scale of 1 to 10, it's a 2, unfortunately.
Your conversation earlier did center a lot on the universal healthcare as the key to unlocking accessible healthcare for all Nigerians. What would you say are the strategies that could be implemented to actually scale up the activities in this area?
Well, first of all, there's legislation. You can pass legislation to make it mandatory for every state government and federal government to put money into UHC. Secondly, is what are the funding sources and mechanisms? There's 1% of the CRF, which hopefully was passed in the law in 2014, which hopefully with the 2018 budget will address that money should be appropriated. And then there are other funding sources. For example, government has increased excise on alcohol and tobacco. All that money can be put into a UHC fund. So one of the issues is funding. But more importantly is even commitment. Commitment by politicians and regulators to say, we want to do a UHC. Because UHC is the bottom of the pyramid. And I can use as examples in my presentation. A number of countries like Indonesia, for example, the current Indonesian president won his election on the back of what he did for UHC in his state. The current president of Thailand, for example, became very popular because of what he did also in UHC. The UK National Health System, which was started after the Second World War, is the largest employer of labor after the Chinese army, employs 1 million people. So, and there's no government in the UK that can reverse the whole NHS system. So I think it really is political commitment, because any politician who decides to front burner UHC and drive it and make it happen will become the most popular politician in Nigeria for a long time. But, you know, we're waiting to see whether this government or any other government will do what it needs to take to make it happen.
Your conversation earlier did center a lot on the universal healthcare as the key to unlocking accessible healthcare for all Nigerians. What would you say are the strategies that could be implemented to actually scale up the activities in this area?
Well, if you go to the private sector, which we are more familiar with, the answer is yes, because to do diagnosis of any patient, for example, the better technology you have, the more precise the outcome of that diagnosis to tell you what the problem is, and therefore you then have the outcome of how you then deal with that patient. You know, it's almost like in the oil industry, where instead of doing 2D seismic, you do 3D seismic, and you have a 90% certainty that there's oil under the ground. Same thing in healthcare. So you have MRI systems, you have the CT scans, you have all kinds of diagnostic tools which are driven by technology, which help to give you precise diagnostic around what's wrong with the patient. So it's already happening in the private sector. The key thing is it's not available to everybody, because it's not, the investment is not on a scale basis. It's a small population, and therefore it's costly. We need it to be on a scale basis, so that every can be used every time, and therefore the cost can come down, and we can diagnose better, and therefore give the right prescription.
Now, from your perspective, which is the private sector, what steps do you think that we can take to bolster the healthcare ecosystem, generally speaking?
We need politicians to really understand and appreciate that one of the ways to ensure that a country can grow and a country can develop is its people, the healthcare of its people. It has to be the number one priority. And until that conversation is won, there's nothing that you and I can keep on saying that will change that will move the goalpost. So when we have that conversation and we agree that we want to put 15% of government money into healthcare, for example, and we want to match it with that kind of funding from the private sector, then we'll see a change. Look what happened in pensions. Today we are all saying that pensions has 6 trillion or 7 trillion of pension funds, but the political commitment. The government said we're going to change the pension law, appointed a group to do so, made it happen, set up a regulator, licensing provision, and made it compulsory for every employer and every employee to contribute to the pension scheme. So, there's no difference, healthcare.
Healthcare, like business, is evolving around the world and has become incredibly complex. And I know that in a gathering such as this here in Lagos today, what we need to be aware of is what we can understand, what we can learn from the changing, evolving marketplace that's out there, and what we ourselves individually gathered here today for this Future of Health conference can do about it. Things are changing so dramatically that in many respects we may be in a uniquely privileged position to be able to leapfrog the traditional problems that healthcare has delivered in the past. The revolution of change that we're seeing in the world right now means that we can be carefully poised to benefit from it to maximum effect. We, as this generation today, have got more opportunity at our fingertips than any other previous generation that has ever lived previously. The era of today is one of the most exciting times this planet's surface has ever seen. And yes, we have problems. We've heard about those this morning in relation to your industry in respect to healthcare here in Nigeria and elsewhere around the world. But it must mean by default, ladies and gentlemen, the situation becomes easier to solve if we apply ourselves to it correctly. A couple of weeks ago, in Forbes magazine, I see you've all got a copy of Forbes in front of you on your chairs now as well. Digital healthcare, let's just think about the enormity of it. According to Forbes magazine, is now a $200 billion a year market already. And that figure is soon going to look incredibly tiny as we roll on beyond 2020 and where we go. It's a marketplace that's growing at over 13% a year. When you look at the enormity of healthcare, demanding new ingenuity and new ideas, whether it's from wearables in the very advanced state or health analytics, or even back at the get-go with basic clinics and clinical trials and new access to new materials, every single facet of our healthcare business or industry has changed dramatically. And we can see new changes in this massively competitive new arena. I'm sorry you can't really see on the slides, but when you're looking at wearables, sensors, connected health, big data, quantified M-health, gamification, wow, the stuff that technology brings us right now leapfrogs so much of the historical problems that we've faced. It is a multi-billion-dollar industry today, growing at around 13% per annum. And when you link health and information, communications technology together, there are already some spectacular results. Stony Brook and Vayu, a US-based organization, partnered with Stony Brook University in the States, delivering medical supplies by drone. And this is reality right now in Madagascar. Have a look at this for a moment.
The man at the helm of affairs as far as Lagos State is concerned. Lagos is Nigeria's metropolitan city. Now, when you think and sit and consider the health situation, the healthcare system within Lagos State, for example, what bothers you the most?
What bothers me the most is that I believe we're not where we should be. And like Michael Jackson said, there's no point in looking in the past. Let us look at the future. And luckily, to all the governments of Lagos that I've worked with have shown enough commitment, they've shown the vision. And in Lagos State, we are not benchmarking ourselves with any state. We are benchmarking our system with other countries in the developed world. It's an enormous task. But I think we have the commitment to go up to do it. Like I said again, we require the change. And that change is here, it should be done now. And we are also lucky in the sense that we need to leapfrog. And we can only leapfrog using technology, which is what all he said about today. The essence is that there's a need for change in the sector, and change involves everybody, every player in the sector, government, the people, the business, private sector, etc.
So now looking forward, need for a change. That of course centers around transformation and leveraging on technology, which is the essence of the conversations that we have been having here. What steps would you say Lagos State, for example, has been making to ensure the transformation from analog medical system to leveraging on the digital?
I'll talk on the general level that the need to create a smart city for Lagos State. This is what government of Lagos State is doing. We're partnering with the government of Dubai into doing this. It's one way of bringing the people together, bringing commerce under using technology to improve development, to bring development to the state and improve the life of the people. With respect to the health sector, I'll look at it from different thematic areas. In terms of leadership and government has to imbibe that commitment to embrace technology, to move the health sector forward. Once you have that, it means the vision will be created, and of course the wherewithal will be provided. 2, we need to partner with the people, especially those people who have the expertise in the private sector, especially those people with the technology, the technology companies, who have all these things that we require. They say we need to partner. When we're partnering, we have to create that precise atmosphere environment for them to operate, so that we can all achieve our objective. With respect to the infrastructure, the essence is to modernize all our facilities, starting with the primary healthcare level, the secondary level and tertiary level. And when we are doing this again, we have to do it in the context of what is happening right now in the world, and of course again, bring technology to bear in service provision. And again, we're going to use technology again to train the human resource people, and that is key, because the world is changing, technology is changing. All our health workforce must develop along the same line. And one of the ways to do this, again, use the technology in training, like I did say, at the medical school level, the nursing school level, colleges of health technology, even the postgraduate level. And again, use technology again in the context of health promotion and disease prevention. And again, we're looking at, take for instance, disease surveillance. Collecting data now is faster for us if you use all those technological devices to help us and improve data. That way, it's faster for us to collect this data, analyze them, and for us to be able to come up with some policies to drive our system. So it's very essential, it is key. And like I said again, if we look at the future of medicine, we're going to go into the age of genomic medicine. They call it personalized medicine. It's not far-fetched from the way people look at it. That's if we decide to not look back and look forward. A lot of things we are doing now, we can be aided, it can be fast-tracked using the platform of technology to achieve this.
The issue of universal health care, I mean, countries all over the world are striving towards this. As I understand, though, not enough. More than half of the world's population actually doesn't have access to quality health care services. Martinez, tell us where the Nigeria government is in achieving this.
Okay, of course, the Nigerian government hasn't done enough. If you check our statistics, sorry, I'm talking like as a journalist. So I know we have I know we have government people here, but to me, the result is what determines what you've done. Mm-hmm. If you compare our healthcare, universal health coverage to what is happening in Ghana, we started about the same time. If you check, there are about 40%. They've had about 40% coverage, and a few years ago we were at 6. Now we are actually at 4%. So that's the result, and that tells probably what we've put in. What my argument has always been on for universal health coverage, my argument has always been there's nowhere in the world where universal health coverage has succeeded when you make it optional. It has to be mandatory. If you make it mandatory, I'm sure we'll get the desired result. Another thing is it should be a front burner. You know, I believe one thing we should do is it should be a legal, it should be in our constitution. it should be a legal obligation for every Nigerian to be on the coverage.
Can we stay on the topic of primary health care, Claire, for you, and exactly outline the reasons why it is not such an attractive investment destination for private players, and how we can change that so as to reduce the stresses to, you know, the secondary healthcare sector that Kunle told is in dire stress?
Okay, thank you. For those of us that are Nigerian in the room, we know that we've been battling with the issue of primary health care for a while. The reality is that if we don't get primary health care right, we can never get universal health coverage. So we need to be able to do it. But obviously, whatever we've been doing for the last couple of decades is not working. So we need some disruption in the industry, but not just disruption, but positive disruption that will bring about transformational change. And this, I would think, would be done through strategic partnerships between the public and the private sector. We've heard about the challenges of public sector with budgets and funding and capacity. We've also seen that we also have a vibrant private sector that at the moment is quite fragmented, is SME players, and doesn't have the scale, but has the capabilities, the efficiencies. What we need is a merger of the two. Government provides, and we do a PPP, but under a different type of PPP. Government has 3 Ps. They have the patients, they have the premises, and they have the professionals. And we in the private sector have the efficiency, have the passion that want to make a difference. That is a beautiful formula for success. And I think Lagos State is taking the lead, if I may say so. I know that the federal government is also doing quite a lot, but if you don't mind, I'll actually use what is going on with Lagos State. The Healthcare Federation, as you heard from Dr. Idris, is actually doing a direct partnership with Lagos State. Out of their 200+ primary healthcare centers, we have done an expression of interest, and we have identified 10 private sector players that are already in the business of providing primary care. The Lagos State government is providing a platform and providing 45 of their 200 centers for the private sector to take away immediately. Their responsibility would be upgrade those existing primary healthcare buildings. We have 10,000 buildings across Nigeria. Buildings don't make it happen. Patients on their own can't do it. We need a formula where we have good infrastructure, good equipment, basic equipment, and then good services. So we have a formula for success right now with the access to finance, with the provision of the concession of the buildings, and then on top of that, the new insurance scheme of Lagos State, where insurance now becomes compulsory. One of the biggest challenges of primary healthcare is the fact that everybody is paying out of pocket. Over 70–80% of our people, every time they get sick, become more impoverished. And therefore, they look for alternative means of healthcare. They go to the traditional attendant. They go to pharmacies that are not pharmacies, the patent medicine stores. They take medicines to wash their blood. You know, silly things that you hear. But they're looking for alternative means that are more cost-effective to get there. So we need to be able to close that divide by, again, increasing the perception of poor quality, making sure that people now know there's access. And if we can get access to quality healthcare sorted by that public-private partnership, that close collaboration, then we can start to make the difference that is required. I think this initial phase, this first, I'll call it a pilot, once that happens, we can scale up across the whole of the countries. There are several states in the room, Delta State, Adamawa State, Edo State, Ogun State, that are starting in the similar heat, where you can have your state health insurance providing another source of financing. So you have an off-taker straight away, providing that source of finance for private sector to engage. Because why would the private sector engage in an investment that you will not get a return on investment? So the trust between public and private sector is now being developed. In the past, I think there was some skepticism. Today, you see commissioners, the Honorable Minister, collaborating on a daily, weekly, monthly basis with us, talking about solutions together at the same table. What can we do? What policies do you need to unlock the potentials?
How would you describe the role of the private sector in improving healthcare across Africa?
I think the private sector can do many things. We bring technology. We're very proud of the innovations and technology we drive. But I think we've also moved away from a company which is focused on medical equipment to a company which is there to partner with governments and actually help them to really redesign how health systems, how healthcare can be delivered in a country. So we can advise, we can help on how hospitals are operated, we can advise on how protocols are done. Because you need to generate access, but you also need to generate quality, which means that you need to train people, capability building. And I think a lot what the private sector is doing globally in Africa can also be used in Nigeria. What I think is important is that I think we've all learned that technology is not just a piece of equipment. So I think if you would think back 10, 15 years ago, healthcare was about selling equipment, selling an ultrasound. But what we've seen is actually that just selling a piece of equipment, even if it's a great innovation, is not really making the impact that we would like to see. So we see now technology developments that are much more embedded in local processes, in education of people, and that makes it much more sustainable and makes the impact much greater. Of course, technology, like telehealth, can make a tremendous impact. If you take a country like Nigeria, it's a huge country, a lot of people. You cannot expect radiologists, for instance, to be next to every patient throughout the whole country, but you can facilitate with telehealth that radiologists in a central location can monitor actually the images and do a diagnostic view from there, sharing it with local doctors. So I think there is a huge impact, but I would also like to stress that the innovation is not just in the equipment, but also very much on the ecosystem in which you embed that technology into, in this case, Nigeria.
How then do you think we can be able to, beyond lip service, beyond conversations, actually leverage on innovations and technology to move the health sector forward?
Well, I think if you look at the total of Africa, but also look at Nigeria, you know access and quality to care is still a challenge. I think technology has made great steps and actually allowing more affordable remote-based solutions. So while 10, 15 years ago, again, we were talking about putting equipment in locations, now you can really talk about offering a solution which you can scale up very quickly and you can drive. And I think governments have realized that they do spend a lot of money on healthcare, but technology can actually help to make it more efficient and actually generate better clinical outcomes. So I think this is the right moment, and if I look at our survey, which is also one of the reasons why we're here today, what struck me is that first of all, Nigerians want to actively take charge of their health. So I think we should not only look at technology sick care, so after the fact, but also technology how we can share, and for instance that can again be via mobile phones, share information with Nigerians on how to improve, let's say, the way they live. Eat a little bit more healthy, exercise a little bit more, because if you work on that now and you're 10, 12 years old, that reduces of course the risk for cancer at a later stage tremendously, and with that also the burden on the health system at a later stage.
Talk us through the specific roles that Philips is playing in moving the conversation around Nigeria's health sector forward.
First of all, I think we are very, very vocal in the awareness and preventative discussion. So we really want to take people to take ownership of the factors that improve their health. And I think that remains key. Again, you have roughly 80 million below 14. If you educate those young people, you give them tools throughout their life to actually manage their health better. I think we also want to drive, let's say, how we use technology in Nigeria based on examples we have throughout Africa. We can come with case studies, we can come with real life examples where we say, we've done this in a country, these are the clinical outcomes, these are the learnings, let's now implement it in Nigeria.
Now, from your experience Africa-wide, to what extent would you say governments across Africa are incentivizing private sector investment in health?
I think governments are realizing that they need to foster partnerships. So it's no longer just private, it's no longer public, it's no longer an NGO, it's bringing them all together. Because if you want to, let's say, offer access to care, sometimes you have to provide electricity, sometimes you have to provide clean water, a clinic, staff. So I think governments are really now embracing the fact that together with private sector they can make a bigger impact. And those incentives are more related to how we work together, that they accept private on the table together with NGOs to really have that open discussion. And I think that's a great incentive. And where we see governments really embracing the fact that they want to drive universal healthcare, you can make great progress.
You know, the thing that really confounds us slightly in Nigeria is that we do have the network of hospitals. We've got mothers who are quite educated, quite savvy and wanting to access care. And we've got health workers who are quite dedicated in wanting to give them that care. But we still have this problem of extremely high mortality. And working at the front line through the Wellbeing Foundation all these years, I realized that that is because we haven't really fully integrated our systems. I think that from a rights-based approach, every mother should be able to feel confident that she can walk into a health center as close to her as she lives, and she should be able to get care that is accessible, affordable, respectful, and to a high quality. Secondly, I believe that we need to be able to track the quality of that care. So I'm a big one for saying every woman should actually have a personal health record in her custody, not just in the hospital. And, you know, adopting this, such as the one that we wrote at the Wellbeing Foundation, versions of which are used all over the world, it does actually empower the mother to be an informed health partner in her own outcomes, because it raises her standard of what to expect. You know, from the mammo care that we do in our antenatal classes across the country, we're discovering that women are now coming in for 8 visits during the pregnancy. They come for the class and then they stay on for the antenatal care, because we only give the classes in hospitals. And none of our women has died. In over 22 months, over 200,000 women. No one single mammo care mom who has been to the classes has died in childbirth. So it does, it speaks to the integration of the system, where you're not just delivering care in isolation in a facility. You need to link that care to the health worker's attitude, to the equipment in the facility, to how easy it is for the mother to get that care, and then make them actual equal partners in getting the right outcomes.
Toyin, within an African situation where the current reality borders around affordability, access, how can we even begin to have conversations around leveraging on technology to improve maternal health?
We have to leverage on technology, because technology is a smart investment that allows us to save money across the board. We're talking about universal health coverage. Universal health coverage is basically, aside from the affordability and the standard of the care, it is basically insured care. So even if that care is free to the beneficiary, it has been insured either by government or by the beneficiary themselves. Now, how do you cut across the economies of scale that you need to without technology? We are going to need technology to provide a data bank of every single health facility, every health provider, and every patient. It is only through that that you can begin to save. You know, if I'm running a health facility and I have only 20 patients and 5 of them fall ill, I cannot provide covered care because the margin is too high. But if, on the other hand, you've got 198 million people, which we are in Nigeria, and all of them are mandatorily insured, if 35% of the 198 million fall ill, you can afford to treat them with the funds of those that don't fall ill. And you can afford to access those funds to improve your healthcare facilities, to make them actually positive, pleasant places where people come to stay well. You know, we haven't even begun to touch on non-communicable diseases, and this is another explosion just waiting to happen. So it actually, investing in the digital end of it to keep everything else connected, it's not a discretionary investment anymore. It's actually going to be a mandatory investment, and the smart, deliberate decision to have us get a better quality across the board, and to also know where to deploy resources to. You know, without the digital element, how are we going to know if this hospital has more of what it needs and not transferred to the next place? And, you know, the issues of wastage. I just think it's a smart investment, and I don't even think it should be discretionary. I think it's a must. It's an imperative.
From exhausting the state of healthcare in Nigeria, efforts at transforming the health sector across Africa, maternal health, and scaling up technological innovations within the sector, one thought has been central at the Future of Africa Summit organized by Philips in partnership with Forbes Africa. The future of digital healthcare in Africa begins now.
Hello and welcome to the CNBC Africa special coming to you from the Future of Health Summit organized by Philips in partnership with Forbes Africa and CNBC Africa. I am Fifi Peters and today we are here to discuss ways we can improve the much needed health sector in Nigeria. Right now we have a situation where too many Nigerians are dying of diseases that can be prevented. What role can everybody play in ensuring that this stops? We will be engaging with the Honorable Minister of Nigeria of State for Health, that is Dr. Osagie Ehanire, and find out exactly what government is doing to address the ailments in the sector that it's been criticized for largely neglecting. First of all, there's a belief that government is not spending enough on health care. What is being done to address this, especially as we're in a situation right now where too many Nigerians are dying from diseases that are preventable?
Well, first of all, I will tell you that there is a very strong political will to improve the health sector, very strong. But I will also tell you, as someone who's in government, that there have been very, very strong competing priorities. It has been mentioned here. This government has been a remedial government. Many people do not realize that when this administration came in, there were issues with food security. There were issues with security in the Northeast. 14 local governments were under threat. As a matter of fact, were occupied by Boko Haram. There were issues in the power sector. We had long lines for fuel, and the energy sector, electricity was down. So if you had asked all the ministers, they would have told you, including the health sector, that they wanted to declare a state of emergency. They would have liked to declare a state of emergency in their own sectors. So the government has had to contend with, first of all, addressing food security. And then the security in the Northeast, they've had to push the Boko Haram out of the 14 local government areas. I'm doing a lot now to address the energy sector. And I believe from now on, investment in the health sector will improve. And I also believe that the promised realization of the 1% basic healthcare provision fund from the National Health Act will be realized, and will begin the great leap into improving the health sector funding.
What will drive the improvement in the health sector?
Primary health care. That has been variously spoken of here by all parties, and the government of the day wants to put a lot of money into primary health care. But primary health care is not only health care in areas like in Lagos, where you have an urban poor, but in very remote areas where you have no roads, where you have no facilities at all, no electricity, no water supply, all those areas are not going to be left out. So the demands of primary health care is varied. If you are going to be able to provide care to all Nigerians, you must develop various strategies that address the needs that vary from cities to the rural areas.
I imagine for you to do this, so you will definitely have to have partnerships, because right now you're still in a situation where you do have competing other interests that are very important for Nigeria's economy, as you have mentioned. In bringing in more partners, what is government saying to particularly the private sector to encourage them to partner more with government?
The government has opened its arms to the private sector and has in fact put a lot of emphasis in making it clear that the private sector is invited into all sectors, including the health sector. And somebody has also mentioned here that the private sector includes even the small players, these SMEs, and in the health sector, even the patent medicine vendor provides its own service even in rural areas. It's very difficult to get health providers to go to rural areas to work. So partnering with those who are willing to go to rural areas to work is one of the strategies that we are going to have to adopt. And also, in fact, in the areas of heavy investment, particularly in tertiary healthcare, Someone also mentioned investment just now in MRI at Igbobi Hospital. The government is in many ways inviting the private sector to come into this area, in the areas of diagnostic, in the areas of cancer care, and particularly where investment is going to be difficult for government to provide in view of all the varying competitive needs in the country.
And one of the challenges that was also raised was the lack of collaboration between the different tiers of government, that they're not talking to each other, they're not on the same page. What's being done to address this?
Oh, there is communication. We in the health sector work very closely with the Ministry of Water Resources, with the Ministry of Environment, and also, in fact, with the Ministry of Women's Affairs, which is responsible for family matters. And we need to be able to deepen this collaboration. It has been variously stressed here that primary health care begins with preventive health, and preventive health begins with water, sanitation, and hygiene. These are actually in the domain of the Ministry of Water Resources and the domain of Ministry of Environment. We have been talking with them, and if we're able to take care of these aspects, provide proper maternal and child care services, and provide improved immunization, we will have taken care of 60 to 70% of the problems of Nigeria.
Sure. Education. So we've heard throughout the day that prevention is better than cure, and we need a proper strategy in place to educate Nigerians, particularly young Nigerians, about the importance of health, especially as diseases that are related to lifestyle are on the rise, and they can be prevented if people take it upon themselves, if they know. How is government planning to increase education around health matters to the general public?
Well, education is very important, and I will say that prevention is not only better than cure, prevention is cheaper than cure. And the various areas of collaboration have been mentioned. First, in education. The educational aspect, health aspect of education need to be strengthened right from primary school. Then there's, of course, the work of the community health workers who do a lot of work in rural areas, and they're using media, social media, and mobile communication to be able to reach people on aspects of health. Right now, Nigeria is also battling with drug addiction, particularly to codeine, which is affecting young people. So the strategy to work with the Ministry of Information and with Ministry of Education to create better communication with regard to public health and to personal health, and in fact also to domestic health and hygiene, is something that is going to be prioritized. The collaboration goes across various sectors and also across various actors in the both public and private sphere.
The issue of medical tourism. We heard at the beginning of the day that Nigeria loses some $1 billion to medical tourism, wealthy Nigerians that can afford going to seek better health care elsewhere. That's essentially a leakage in your system that can be directed to areas like upgrading existing infrastructure, hospitals, equipment, and the like. What's the plan to reduce this leakage?
Well, yes, we are told it is up to $1 billion that is lost annually because of medical tourism. It has been said that, in fact, that's not tourism. Yes. It's something else, which is true. And it's largely due to, in many areas, loss of faith in the health system. And that loss of faith is what we are trying to address. Events like this contribute a lot to learning and to finding ways of being able to improve service delivery at the primary, from primary to tertiary. Of course, the medical tourism takes place at a high income level of those who have the money. And repatriation, knowledge repatriation, a large number of Nigerian experts who are outside the country will be in a position to come back home with the knowledge and skills they've acquired if the enabling environment is provided here. There are countries like India, where, as a matter of fact, the largest chain of hospitals, the Apollo hospitals, we are told is founded by Indian doctors who came back from the United States. So we're looking for possibilities of repatriation of knowledge and skills from outside the country. And if I may also speak to the aspect of brain drain,
for sure.
We have a problem with that because for brain drain, you need to have takers, you need to have the supply and the demand side. Many advanced countries, United States and UK, are looking for doctors who also man their rural areas because most doctors in these countries want to work in the cities. And they have a shortage of doctors in rural areas. So the bar for visas for doctors and nurses is lowered so that you can have importation of doctors, not only from Nigeria, but from India and other countries that take care of health needs in poorer and deprived communities in developed world. That is a problem for us. In America, to train a doctor will take you $300,000 to $400,000. In Nigeria, it's just a fraction of that. As a matter of fact, education, tertiary education is in fact free. So it's very easy for developed countries to, if you like to use the word, poach doctors from countries that are producing doctors and at a fairly cheap rate. But to retain these doctors is not going to be easy. As I said before, we need to go to encourage them to repatriate their knowledge and skills by the time they have grown very well established in Europe and in America. And there is also need to raise salaries here and improve the working conditions. But I don't think we are ever going to be able to match salaries outside the country. And producing, particularly for primary healthcare centers and some other centers, fit for purpose personnel. That is to say, personnel that are not necessarily doctors, but are trained well enough to be able to take care of the most basic things that you need. The attrition rate for such personnel will be much less. So I took on board what was said about customization. Standardization of training is okay, but customization, being able to create a healthcare cadre that will address particular needs and be strengthened and capacity built well enough to give you that kind of service you want where you want it, where the attrition will not necessarily be that high. If you take persons who come from a particular community and train them to carry out certain services, you are more likely to retain them than if you took people from other communities and wanted to post them to that community, they would not like to stay in there. So we have to develop methods and strategies that will solve our problems, particularly at primary healthcare level. We need to go to send personnel to the most remote areas where orthodox doctors and nurses may not like to serve. So these strategies are strategies that the Ministry of Health has been looking at and will continue to work upon.
Of course, I mean, many people who get into the medical profession do so because they are passionate about improving health, but also there is the monetary element of it, because those very same professionals, you know, have families themselves. They need to put food on the table, educate their children, so they do need decent pay. You said something concerning to say that, you know, Nigeria won't be able to necessarily match the kind of remunerations that doctors are being paid abroad. So if not for the remuneration aspect alone, how else can you entice the medical professionals locally here, I'm talking about doctors and nurses the like, to stay at home and address the need here?
Well, first of all, there's just a moral appeal, stay. and then there's also the need to ask those who have been trained at government expense to give a certain minimum number of years and agree to voluntarily give a certain minimum number of years of service before they consider going outside the country or leaving the country. A good number want to leave, and I understand because the pay is better outside. But I think it will be difficult for across the board for government to go to pay what doctors earn in the United States. We see that even within Nigeria itself, where federal government-owned hospitals pay more than what many state governments pay, and you have a concentration of doctors in federal medical centers and very few at the state medical centers because the pay is different. And there's one of the states where I'm told that a particular department had 22 specialists in one of the government teaching hospitals, and across the rest of the state, only 2 of such specialists serving the rest of the state. So the pay disparity between doctors who work in abroad and here, and doctors who work here in Nigeria at teaching hospitals and at state hospitals or local government hospitals is a problem and should be addressed in some way.
The issue of universal health care, many countries have a long way to go still, but it has to be done. Where is Nigeria in that game?
Universal health care is cardinal to government's strategy. And as I said just now, the universal health care needs to be extended to all areas, even to the most remote areas where the need exists, and we have to find a strategy, but to be able to realize it. But you need first the infrastructure. Then you need the human resources, and the human resources need to be trained and deployed in such a way that you have retention. Then you need the commodities, you need the drugs, you need the supply chain management. You may need, for immunization, you need a cold chain. And then you also need the data management. And here again, we have heard a lot here about mobile technology being used here. So that's going to be very useful. But I also believe that the service in primary healthcare centers needs to be 24/7, needs to be at night also. So you need electricity, you need water supply, that has already been emphasized here. And you also need access. One of the best primary healthcare centers I have seen is one built by a philanthropist, and he stationed a little ambulance, a 3-wheel ambulance, in the primary health care center with telephone numbers to call, which women are given during antenatal care. And because a lot of deliveries occur at night, and in rural areas there is no access even to get to the primary health care center or to the maternity, it's a problem. So what is encouraged is that they dial this number and the ambulance picks you up from home and takes you to the primary health care center, which I thought is very good and worthy of emulation. So the complete primary health care center will take time, but is necessary to build. And the full package of it should be able to take care of more than 80% of Nigeria's health needs.
The issue of insufficient investments in IT infrastructure that is crucial if Nigeria is really going to take advantage of the enabler that technology can provide in improving the healthcare system. What's the plan to improve the investments that public sector is making towards IT?
Well, the Ministry of Health has an e-health department, and collecting data and using data is primary there. Again, we invite the private sector to come in there, to come in with innovations, solutions. The health sector has not been given all the attention it needs from time before. So the space is open now to expand it in all areas, the health sector in mobile technology and also e-health and IT is an open space for all those who have ideas to come up and let the government, the Ministry of Health, work with you to facilitate introduction of IT into the health delivery. We have heard a lot of presentations today that emphasize all the benefits of introducing IT into health delivery, and the government is very much open to partnership in that level.
There's also the issue of the infrastructure, improving teaching hospitals and upgrading medical infrastructure. as you did highlight at the beginning, to say that the current administration hadn't perhaps done enough that it should have. As we lead up to elections now, what is the risk that as we do have a change in administration governing the country, that we end up in the same position where the new leadership does exactly what the current leadership has done?
Well, that's one of the, I'll call it the risks of the most democracy. This administration took over from an administration that appears to have invested a lot more resources in tertiary health care and focused more on tertiary health care than in primary health care. We had about 30,000 primary health care centers, of which barely 10% were functioning. We are trying to revitalize 10,000 of those ones now, one in each political ward. So the revitalization has been going on quietly. The resources are not as plentiful as we would have liked, but it's going on. We are working with the National Assembly to make resources available and to encourage members of the National Assembly to also break their constituency projects into the primary healthcare sector. But the hope is that the primary healthcare system will have been so developed that any administration that comes in is able to continue working on it and will not reverse it. And we have also heard that if there is a good demand from the end users, every politician who wants to win an election will have to make a promise, not only to retain the good sides of the healthcare strategy, but to improve on it. So it will be definitely a setback if this were all to be reversed. But we are confident that it will be continued. This administration will continue and continue to build on it. And there's a long way to go, but a lot of work has been done, and we'll continue to receive favor from the government.
And then can the people of Nigeria hold you to account in terms of promises that are made that are not fulfilled?
Yes, they do. We would like that to continue. The media, both the print and electronic media and social media, are very vocal in Nigeria, which is good. And the government is very aware of its responsibilities and obligations. We have already said that primary health care is the focus. Quality of service delivery will have to be improved, and that can not only be with providing infrastructure, but also with training of the personnel, and also to improve the attitude. We have heard representations that have promoted the value of performance-based remuneration, which improves service delivery and improves the motivation of health workers. We are looking at that side of healthcare delivery. The attitude, if the attitude and the attitude to work and the attitude to patients improves, I believe that it will also help a lot with retaining patients here. There is reason to believe that there are some people who go abroad for treatment, not just because the facilities are not there or the personnel are not there, but because they feel that they have not been well looked after by the personnel, by the attitude of healthcare workers. So the improvement in service delivery will go beyond providing equipment. We'll go into retraining and remotivating the healthcare providers.
We've heard from the private sector about what their concerns are, about what they're hoping that government can do to address them. Perhaps an opportunity to you to also speak with the private sector about what your concerns are and what you think perhaps the private sector could be doing better to really strengthen the collaboration that is needed to improve healthcare in the region, in the country, and on the continent.
Well, in the first place, we're encouraged by the great interest from the private sector. Not long ago, I was at an event here where the focus was on corporate social responsibility from the point of view of various corporations here in Nigeria. Some are interested in malaria, some are interested in reproductive and maternal health, and so on. So we need to be able to have conversations with the private sector to avoid duplication, to avoid waste of resources, and to also be able to galvanize whatever they are giving in service delivery and direct them to areas where these services are needed. There are occasions where 2, 3 actors from the private sector are working in one area, and there are other areas which are totally unserved or underserved. In the Ministry of Health, we call those orphan states where nobody is working, where private sector should also be involved. We're also talking in this case about the NGOs. But by and large, I think the private sector investment, for those who are interested in recouping investment, have to do a good homework. They do the business case analysis, and the government is willing to work with them in whatever their findings are.
Honorable Minister, thanks so much for your time. That, of course, was Dr. Osagie Ehanire, the Nigerian Minister of State for Health. And that is where we leave it. Thank you so much for watching the CNBC Africa special, coming to you from the Future of Health Summit, organized by Philips Africa in partnership with Forbes Africa. Bye for now.